Thank you, everybody, for coming. It's great to reconvene as part of the monthly seminars for the Superfund Research Program. And I am, for those online, I think everybody here knows me, but for those online, I am Ana Navas. I am the director of the Superfund Research Program. And it's a pleasure to introduce our speaker today, Dr. Keeve Nachman. And Keeve is an assistant professor at the Department of Environmental Health Sciences at Johns Hopkins Bloomberg School of Public Health. He's also the director of the Food Production and Public Health Program at the Center for a Livable Future that is also housed in the School of Public Health at Johns Hopkins. And it's very, very easy for me to tell you about Keeve's education, what is wonderful for me, because sometimes I get confused with the different universities, because Keeve did his undergraduate, his Master of Health Sciences, and his PhD program education at Johns Hopkins University. So he got there, he realized it's a great place, and he stayed there. But after finishing his PhD, actually we were very fortunate to work together. He was the second reviewer of a systematic review that I did when I was a PhD student myself. I did together with many people. I was the first reviewer, the first reader myself, and he got the honor of being the second reader. So that's when we first met as students. And after finishing his PhD, working on arsenic and poultry waste, I believe. So that was his PhD thesis on. And after that, he got trained really well in risk assessment, really the person to go to for any risk assessment process. He went to the EPA, and he worked at the EPA as a risk assessor for the EPA. Also for the US Corps of Engineers, is that? He also worked there. And then he was recruited back to Hopkins as a faculty in EHS, but we were very, very lucky. I would say many things to highlight from Keeve's work. I would select just two. One is that his work was he's very policy oriented, really wanted to make sure the research is relevant, has an impact. And his work had a major impact in the banning of poultry arsenic drugs, including roxarsone and nitrarsone. So that was really very important work, and I was very lucky to be a collaborator of Keeve's as a leader in this, all of that work. And then the second thing I would highlight is that Keeve is really a great communicator, and he's often asked by media outlets like newspapers, TVs, radios, etc., to discuss science and environmental health science. So we are lucky to have you today. So Keeve, thank you so much for coming to New York and to the Columbia.
Thank you, Ana, for that introduction. It's so great to be here. I really enjoyed spending time with a lot of you today. So thanks for your attention for a little bit longer. I'm really excited to share this project with you. It's been a long time coming, and I'm really thrilled to. This is one of the earliest demonstrations of some of the results of the study. So, okay. So it's okay. We're almost there. Oh, perfect. Okay. Thank you so much. So I want to talk about a project that I've been engaged in over the past couple of years, looking at exposure to metals in the context of growing food in the city, and not only in the science and what we found, but also all of the ancillary issues of communicating what I found with people who were actively engaged in growing food in the city, and dealing with the fact that I think about issues of metals exposure and risk in one way, and recognizing that not everybody thinks the way I do. And sometimes that creates real challenges in trying to help people avoid exposures and improve their health situation. So urban agriculture is a phenomenon that's growing in popularity. There are a lot of great reasons to do it, and the literature base for potential benefits from growing your own food are expanding pretty rapidly. There's evidence for increased social cohesion, community involvement, the provision of ecosystem services, public health benefits like increased individualized access and consumption of fruits and vegetables, and in some cases improved economic development and land values. So lots of good reasons to think this is a good thing, and there's a recognition now that we as a global society are facing a a rapidly increasing population, and in many cases a food supply that may not meet the needs of a growing global population. So right now, about half of the world's population lives in cities, and it's estimated that by 2050, about 3/4 of the world is going to live in a city. And so one opportunity for feeding our growing population is the idea of growing food in cities. And so I think it's great. I think there's evidence of potential benefit. But when I was first introduced to the concept, I was panicked. So Anna mentioned that I had a history working for 2 federal agencies. And when I was at the Corps of Engineers, one of my responsibilities was reviewing risk assessments that supported transfer of ownership of formerly used defense sites, or FUDs. And in many cases, those FUDs were in cities. And I saw firsthand some of the data collected on contaminants in soils in cities. And I thought, yeah, it's great to grow food, but these people are in soils that may be loaded with metals and other contaminants. And I'm a little alarmed by that. So I got a very small grant from the Johns Hopkins Urban Health Institute and pursued a study looking at people's perceptions of risks related to contact with contaminants in urban soils. And what we did is we interviewed a number of urban gardeners at about 15 gardens around the city, and we talked to a variety of stakeholders who were involved in providing guidance and supporting urban agriculture participation. And we wanted to figure out, are people thinking about exposure to contaminants in soil? And if they are they testing their soils? If they're testing their soils, do they know how to interpret the results? Do they know how to learn more about how the sites may have been used prior to establishment as gardens? And if so, are they changing their behavior accordingly? And what we found is an array of responses, but generally a low concern related to exposure to metals in soils or any other contaminants in soils. But what I think was most valuable about my participation in this study was that I built some really terrific relationships with non-governmental organizations in Baltimore City that support urban agriculture participants. And after we'd finished the study, we reported back to the community. We provided them with some resources to figure out how to test their soil and how to interpret their soil results. My partner said, hey, Keeve, it's really great that you've helped us understand what our perceptions are, but we want to know about the levels of metals in soils. We really want to dig a bit deeper and talk about real potential risks that we may face. So I thought that was a reasonable request. And so I started thinking about what we could do that would allow us to answer real questions. And really, these questions were perceptions that existed beyond just the people who participated in agriculture, but one that was raised by people who grew food in the city for sale was that people believed that fruits and vegetables grown in the city were dirty or dangerous. And so they wanted to know, when you grow food in the city and you eat that food that's grown in the city, are the exposures to metals that you would incur any different than what you would expect at the grocery store, or even at farmers markets or any other setting for food production? And then also, this is the one that I was more worried about, is when people are actively engaged in growing food in the city, what do their exposures look like? Are they being exposed to unreasonable levels of contaminants? And is it a practice that we really should be promoting in a city like Baltimore that has a history of older homes that, when they're demolished, release lead into the environment, and many other potential sources of metals that may ultimately find their way into urban soil? So is this a good idea? What do people's exposures actually look like? So these two community-motivated questions kind of pushed me to dig a bit deeper. And so I put together a team of people, both some technical folks and also some community partners. And I can't emphasize enough how valuable it was to have the community partners. Obviously, my scientific partners are great value too, but I come from an institution that has a history with communities that isn't always a positive one. And I think even though I feel very good about my willingness to do research that supports the well-being of the community, I'm seen as Hopkins, and any baggage that Hopkins has with the community is going to be imposed upon me as a researcher coming in to ask you if I can test your soil or try and understand your situation. And so having these partners meant that I could at least use their influence to try and start a relationship and establish trust over time. And this is a project that's taken about 3 years, where we are right now. And I feel like we've gotten to a point where we've established that trust, and we're seen as credible enough to try and talk with people about their situations and help them understand their exposures and how they can best avoid them without feeling like I'm coming in to take advantage of them, not share anything we find, and then leave and off to my next grant and project. So the Parks and People Foundation supports community gardeners with resources, seed exchanges, information exchange. The Office of Sustainability is part of city government, and they develop guidance for urban agriculture, which is terrific. The Farm Alliance of Baltimore is a terrific partner that is supporting farmers who are growing food for sale in the city, usually at farmers markets. And then University of Maryland Extension always supports farmers, but they specifically are designed to help urban farmers grow safely and productively. We also partnered with the USDA Agricultural Research Service, who did a lot of our analytical work, saved us a lot of money, and really allowed us to broaden our wings and include as many gardens and farms in the city as we could recruit, which was amazing. The EPA National Risk Management Research Laboratory did some chromium speciation for me, which really got us out of a jam that I'll show you in a moment. And lastly, other colleagues, Anna Rule and Ghassan Hamra from Johns Hopkins helped with laboratory and statistical analyses. So an amazing team, very fortunate to work with all these people, and we couldn't have done it without this diverse group of partners. So here's kind of an overview of the study, and I'll show you all the various pieces. So we wanted to do two things. We wanted to collect the real-world evidence necessary to answer questions about risks of urban agriculture in Baltimore, both for people who are growing the food themselves and for the people who are eating food grown in the city. And then it was really important to us, as I mentioned before, to make sure that everybody who participated in the study fully understood what we found and what it meant for them, and whether or not any changes to their behavior were needed. And that was kind of key in designing the study. We narrowed things to community gardens and farms. We did not go to people's residences and do testing in residences because we thought that would sort of change the equation for helping steer people with behavior and some of the consequences of what we found. So at each site in the city that was willing to participate, we did a survey that took about 45 minutes and characterized an array of things that I'll show you in a moment with regard to their practice, who was spending time on site, what they were growing, what their inputs and outputs were, and many other things. We also collect a sample of any irrigation water sources that was available at every site. We did an array of different types of soil samples. And then lastly, at a good fraction of the sites that were involved in the study, we collected urban grown produce. And we collected more than that too, which you'll see in a minute. So recruitment started in summer of 2016, and the way we kicked things off is we worked with the Farm Alliance of Baltimore and the Parks and People Foundation and their lists of participants or networks to try and recruit as many farms and gardens as possible. One of the challenges is that those networks are a lot of work to maintain, and they maintain them very passively. And so urban gardens and farms can be kind of transient in terms of who's in charge and who's responsive. And so we had to go beyond their networks, because I would say initially about 50 to 60% of the people that we were connected to through them didn't answer the phone or no longer active in those gardens. So we had to do a snowball effort, both through word of mouth and through social media, to identify additional farms and gardens. And in order to incentivize participation, obviously all the results that we generated would be reported back to people. And for a lot of folks, that was enough. So anyway, that's how we recruited people. We also offered confidentiality for participation, which ended up being a big deal for a lot of people. Especially if you're selling produce and we're testing your soil, you may feel that if we release your results to the public, you may lose your clientele base if it turns out that the results are indicative of higher levels of metals, even though, as we found later, relationships between what's in soil and what's in vegetables are not always that well correlated. But anyway, we identified 145 farms and gardens in the city that were active during our recruitment period, and we were successful in recruiting about 3/4 of them. So 104 participated in our site. In order to be part of our study, you had to be within Baltimore city limits. We didn't set out to include any schools, although some ended up opting in to participate, and we were okay with that. We did exclude any home gardens or gardens that serve fewer than one family, and you had to be growing food. So if you had a flower garden, we didn't include you in the study. And this is a heat map of where they are to protect the confidentiality of participants, but they were generally spread throughout the city. So we had good coverage. Our survey, we initially tried doing it online, and we learned quickly in reviewing the results of the survey that there were challenges with people understanding our questions. And so we tried to transition to doing things by the phone or in person at urban agriculture events when possible. And we were able to go back to some of the people who filled them out online. Thankfully, they provided their contact information and helped make sure that they understood the questions and that we felt confident in our data. We tried to figure out what people were growing, and that was helpful later when we wanted to go out and collect urban grown produce. If you don't know who's growing what and when it's ready, it can really challenge you to get food that's reflective of what people actually eat. We wanted to know who spent time on site, who was an active participant, and how often they had visitors. This is helpful in building an exposure assessment, which is something we'll eventually do. We wanted to know what they were doing on site. We wanted to know how the sites may have been used in the past, whether or not people were aware of that information, and what other sites may be proximal that may be contributing to potential contamination. And we wanted to know if they had tested in the past. And one interesting thing about contaminant testing in the past is if people indicated that they had done contaminant testing, we asked for a copy of that test. And in many instances, the contaminant test was a fertility test and didn't have any of the contaminants that we'd be interested in. So it's helpful to recognize that this is not a criticism of anyone that participated in our study, but we're all in some way tied to environmental health in this room, and we take it for granted that the things that we know are not things that everyone knows. And so it's valuable to know testing means lots of different things to lots of different people. So it helps gear us in our communications to steer people in the future. So at every site, we took a couple of different types of soil samples. We obviously are most interested in the growing area soils. So what we did, given that we had so many sites and we didn't want to drive our USDA partners totally crazy, is we did at least one composite of the growing area soils. So we, ahead of time, took an aerial photo of the map from Google, the aerial photo of the garden from Google Maps, and we designed a composite and we'd resample that composite once we did it. We also, every time we went out later and collected a vegetable sample, took a scoop of soil at the base of the plant to try and assess relationships between the soil and what's measured in the plant. And then we collected 2 non-growing area samples at every site. One was intended to capture soils that people may spend time in but not necessarily be cultivating. So this might be an area between 2 raised beds as an example. And then we wanted to know what the site may have looked like prior to the establishment of the farmer garden. I always call this native soil. And whenever I do that in front of my agronomic partners or USDA partners, they get really mad at me. So it's not native soil, it's undisturbed soil. But this allowed us to sort of assume, if the site had never been established, what might the levels of metals look like as compared to the garden soils that people are actually cultivating for food production. So these are the types of soils. If people had finished compost, like compost that wasn't lumpy with food or other items or leaves, we also took a sample of the compost as well. We took irrigation water samples. I think I just was too excited about showing all the photos of the people out in the field. Many sites had multiple sources of irrigation water. Sometimes people would bring a cistern of water from home. Sometimes people had rain barrels. Sometimes people had a spigot on the side of a building. In many cases, they had multiple. So we sampled anything that they would have been using. So here's sort of an overview of what we collected in that regard. 235 water samples overall, 121 unique sources. We started midway through collecting what people had actually connected to their water sources, so we didn't do that systematically. We haven't done analyses with these yet. The reason we care about hoses is that hoses can be additional sources of metals beyond what the spigot itself would provide. But I was interested in the breakdown between municipal sources and barrels and any other thing that they did. So we also collected produce, and this was the biggest challenge. Soil pretty much stays put. Water sources kind of stay put, but produce doesn't stay put. It's a real moving target. And so we, based on our survey, identified 13 different fruits and vegetables that we wanted to collect based on their popularity of growth. We tried using information about poundage or about harvests, and it was very, very challenging with surveys. Most sites don't really track their productivity, and that's understandable. If you're growing for a hobby or you're growing for your own family or yourself, you're not doing a systematic collection of those data. So we went with the popularity route. These are the most popular items. I love the word cucurbits. Didn't know that one before we started this. But anyway, we wanted for each of these 13 items to get at least 10 urban samples. And we didn't want to do more than one sample of a cucumber from one site. So we made sure that each sample came from at least a different farm. We ended up with at least 12 samples of each of these 13 varieties. We got the most kale and the most tomatoes. Those were super popular. And again, we got soil samples every time we took one of these. But in order to make this happen, we had to know who was growing what. We had to know who was going to be at the farm when. We had to know when it was ready, and we had to have my people there. And I sometimes like to acknowledge the logistical challenges of actually getting there to get one of these, because if it was overripe or something had bolted or it was rotten, there's no point in testing it because the composition could change, the water content could change, and we're not truly reflecting exposure. Early on in the planning, some of our farm partners had said, you're going to measure metals in our produce, and then our produce is going to have this perception that it has contamination in it, but you're not necessarily going to test from the grocery store or from farmers markets. So in order to look at potential differences across those settings, you've got to go to grocery stores and farmers markets. So we decided that for these same 13 items, we would go to grocery stores and purchase conventionally produced and organic samples, not necessarily expecting any reason to expect differences between conventional or organic samples when it comes to metals. Other chemicals like pesticides, yes, obviously differences. But we thought it would be valuable for communication purposes to have both. And then lastly, one of my PhD students said it would be interesting to look at farmers markets selling in the city. So we also went to those vendors who grew outside of the city but sold in the city and were not producing things organically, because if you're doing USDA organic certification, you may as well be in the organic category. So 4 mutually exclusive groups of produce production for 13 items. So there's a lot of samples. Just to sort of show you some diversity in mapping here, these are where our kale samples came from, tomato samples, and every site provided that participated in the vegetable provision, some combination of those 13 items. Some just did 1, some did 9. We also went to supermarkets throughout the city. Initially went into this thinking that let's just pick the supermarkets that are closest to where the urban farms and gardens are. But upon digging into the literature and experience from folks we've spoken to, people don't always shop at the grocery store closest to where they live, even if they're in an area that's underserved. And so what we tried to do then, instead of going to the most proximal grocery stores, is diversify the types of grocery stores we went to. So we went to Save-A-Lot, and we went to Whole Foods, and we went to international grocers, and really tried to do a lot of economic and chain diversity, and I feel like we did a decent job capturing that variability. Here's a map of the farmers market produce collection. So we hit every farmers market in Baltimore City. One thing that's important to recognize for those of you not super familiar with farmers markets is that it's usually the same cast of characters at every farmers market. So we didn't want to go to 2 farmers markets and buy from the same vendor. So what we ended up doing is making sure we knew who the vendor was, and we also collected data on where their farms were. So we have some sense of where these are coming from. And it turns out that at the farmers market, it is pretty local, right? So the furthest away we got for Baltimore farmers market vendors was about 3 hours drive time. But the majority were within 2 hours of Baltimore City. So we have this peri-urban category, and that's kind of what I call the farmers market group. So in terms of processing our produce samples, there were a lot of challenging decisions to be made. And so our goal was to replicate what people actually experience when they're consuming produce. So if I were to go around the room and say, how do you prepare your tomatoes, right? Or how do you prepare your urban grown tomatoes? I would imagine there'd be quite a bit of variability in how people do it. I mean, I know what I do. I'm lazy. I just hold them under the water until the entire surface is wet and then we're done. But there, so what we did is we did this informal, we had to make a decision. We had to do things uniformly for the different produce types. And so we asked for those 13 items via a survey distributed by Twitter and Facebook. Non-scientific, I recognize that. But we had to come up with some way to deal with the produce items. And so what we ended up doing, what we ended up doing is we washed the majority of all the produce items for 5 seconds under running water. And then for beets and for carrots, we peeled them. And we felt that was a reasonable set of decisions to make. It introduces some uncertainty for people who don't peel their carrots. I don't know anyone that doesn't peel their beets. Anybody not peel their beets? Anybody online not peel? Really? You eat beet skins? I've never seen that before. That's cool. Okay, let's talk more. But yeah, so we had to make some difficult decisions. And so our leafy greens, we also needed to not include any excess water when we processed them, so we dried them in a salad spinner. And I was so excited to say I'm the first investigator at Hopkins who has a salad spinner in his lab. Turns out I'm not. But anyway, we processed each sample into this beautiful salsa-like paste, and then we froze them, and then we took them down to USDA where they had these enormous freeze dryers, and they freeze dry hundreds of our samples at a time. So I did not have a freeze dryer. Okay, and then we processed all the samples within 24 hours to make sure that we retain the water content. Even though we were probably faster to process our samples than many people who would actually go to the farmer's market and actually let it sit on a bench for a while before they eat. So here's what we looked for, and this man is Eaton Codling. He is from the USDA. And he and Carrie Green were our gracious collaborators who tested all of our samples at no cost to us. But we looked for an array of metals. Many of these are metals that are very familiar to folks in this room. But the toxic metals that we looked at were arsenic, barium, cadmium, chromium, lead, and nickel. Barium we added that may be unfamiliar to a lot of you. We, through reading the literature, had found that actually in New York City, barium tended to be an issue in urban agricultural soils, so we thought it'd be interesting to also look in Baltimore. Our basis for deciding what chemicals we were going to treat as toxic or look further into were the existence of numbers in EPA's Integrated Risk Information System, where we had reference doses or cancer slug factors. And so all of our analytes, all of our samples were measured for these analytes, with the exception of we didn't look for phosphorus in water, and we only looked for selenium in water. Okay, and so here are some beautiful pictures of our soil sample processing. Nothing all that exciting to report here, except for we did have these really neat former map chests of drawers where we dried soil samples. They had sort of the most creative way to deal with mass volumes of soil samples all the time. There was a special building on the USDA Beltsville campus that was just a room full of these map chests. And so we got to set up all our samples and let them air dry over a couple of days. So it was nerve-wracking that samples would get mixed up in order and would fall over, and everything was fine. I worry about everything. But anyway, that was our process. We used a couple of different digestion methods based on the fact that I had certain questions about metals that were different from my USDA colleagues. So they were interested in this because they wanted to explore plant uptake of some of the specific metals. So they wanted to do this diethylene triamine pentaacetic acid, or DTPA digestion, that aims to give you the available amount for plant uptake, but I'm interested in doing a risk assessment, so I wanted to do this aqua regia, more thorough digestion that gives you a pseudo-total concentration of metals. We did not do a hydrofluoric acid assessment because chances are in the real world it's unlikely that even humans would release the totally bound up particles of metals from particles. And then we did ICP OES to measure the concentrations once they were in solution. With water sampling, we acidified them to kill any sort of microbes that would impede assessment, and we did ICP-MS in Honor Rules Lab at Hopkins. Our produce sampling, we took our freeze-dried samples and we made these beautiful little powder packets. Can anyone guess what this is? Beets. Yeah, good. People often get that right. Yeah, so we produced them into these powders, and then we digested them in solution and looked at them through ICP-OES as well to give our metals concentrations. So here's the interesting thing from a risk perspective. So it's one thing to measure, it's another to make sense of it. So I was talking with we were talking before about how soil is kind of the redheaded stepchild of environmental regulation, and that we don't have terrific standards or regulatory guidance for metals in soil, certainly not in urban agriculture. We also don't have regulatory standards for metals in irrigation water, and for specific individual produce items, there are not metal standards. Just out of curiosity, does anyone know the one food where there are regulable metal standards from the FDA? Anyone know? It's one food.
Fruit? Did you say fruit? No, food.
One food. One food. Anyone know? Candy.
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 That's food.
So whether candy is food or not is maybe debatable, but that's the only thing you stick in your mouth that FDA regulates. So anyway, we had to come up with some way to take the measurements that we were doing and make sense of them. So I wanted to kind of share some of the thinking that we were doing that allowed us to generate these data and then interpret them for people, because I am a big fan of not generating results that are uninterpretable, that are not able to be communicated to people and allow them to make decisions about whether behavior change is needed. And so what we do have for soils is an array of different entities, federal and state and local, coming up with these guidelines for usually for site cleanup. So if you're going to clean up a site and you're going to use it as a commercial facility or an industrial site, you'll have certain soil standards that not only take into account the toxicology of the compound you're dealing with, but also make assumptions about people's activities and behaviors that dictate their relationship or their contact rates with soil. And so what we ended up finding, this is an example of a demonstration of how different places do this differently. RGV stands for regulatory guidance value, and so we needed to pick a regulatory guidance value to compare our data to in order to help people know if they were experiencing soils at levels of contaminants that were higher than we think were okay. So this is just an example with cadmium. All of these are in parts per million. So this is for a residential site use. You can see that New York State has a regular residential level of 2.5 parts per million for cadmium. Maryland has a 3.9 parts per million, but then if you go to New Jersey, it's 39 parts per million. Now, I guess the assumption here is that people in New Jersey are super resilient and cadmium doesn't affect them at all. No, but what is happening here is, for the most part, we're using the same toxicology values, but we're making very different assumptions about what a resident in New Jersey is doing than our assumptions about what a resident in New York or Maryland is doing. And so for every metal, state to state, even looking at federal recommendations, these numbers can be very different. And what's really important is that the assumptions I make about a person who lives on a site and their contact with soil are probably pretty different than what we would assume about somebody who is working occupationally on an urban farm or a rural farm. I would generally assume they have much more contact, but we are in a state where we don't have really great information about agricultural exposure factors. And actually, I have a PhD student who's working on that right now. But you know, barring having those data on hand, we needed some way to take our soil measurements and calibrate them against something to let people know whether they need to change their behavior based on what we know now. So that was one of the challenges. Oh, and sorry, I meant to show that before. Here's a commercial soil cleanup objective, 9.5 parts per million. So different assumptions about contact time and exposure. And none, we were not able to identify any that were specific to agriculture. So with that in mind, I had a student who I forcefully required to spend hours and hours and hours with the most boring documents in the world, the technical guidance documents supporting the development of these regulatory guidance values. And she compared across a number of East Coast states and came to the conclusion that the New York State soil cleanup objectives for the residential scenario seemed to be the most conservative or protective and assumed the greatest rates of contact. One thing that they did that was really helpful is they assumed that there was some home vegetable consumption. Not behaviors related to cultivating soil, but at least they were eating urban grown produce. So it was a step beyond the other residential type assumptions, and so that was a good thing. So we had these chronic numbers that we compared to people who would be spending long periods of time there, and we also wanted to know if any of the soil levels were high enough that they trigger any of these acute numbers, which means that like there could be a short-term health outcome that could occur from typical contact with soils. And these levels obviously are much higher. Are they appropriate? Not sure, but are they the best we have on hand right now until we develop some real data about agricultural exposure factors? Probably. Okay, so with water, again, I mentioned no standards for irrigation water. So what we decided we were going to do is we would take drinking water standards for all of the metals that we included in our study, which sounds reasonable and possibly overprotective. Do people drink irrigation water at urban agriculture sites? What do you think? Yes? Who thinks yes? A couple. Hopefully not rain barrels. We didn't find any evidence of people drinking out of rain barrels, but that's because of microbial contamination. But we did find and heard a number of anecdotes from people who said, we're out in the summer, we're growing, it's hot, there's not another place to get water nearby. I might drink out of the hose. I might stick my head under the spigot. Or kids that are playing nearby in city don't have access to another source of drinking water. They'll drink out of the hose. It's common. So does that compare with the assumptions we make about people who drink residentially? So when we develop a maximum contaminant level, we assume that that's people's primary source of drinking, bathing, cooking, teeth brushing, swimming water. So it's unlikely that people in cities who drink out of the hose once in a while are coming anywhere close to that level of exposure. So we felt confident that people were exposed at levels that were protected by these would be okay. And so we have health-based standards that are in the form of these maximum contaminant levels that are promulgated by the EPA. For some of the things we measured, we have aesthetic standards, but they're not health-based standards. But the health concerning levels of these would be much, much higher. But then two of the contaminants, copper and lead, don't have MCLs, but they have an EPA action level whose regulatory process is a little less straightforward than the MCL, but we thought those would be reasonable numbers to use to make judgments about the adequacy of lead levels and the copper levels in water. So had to come up with something, and that's what we decided to do. Fruits and vegetables were the biggest challenge. There are not standards in the US for specific fruits and vegetables, which to me, especially as we dove into this, was really hard to reconcile because we had set out to measure the levels of metals in these various foods, and not having anything to compare them to was really a challenge. And so obviously the participants in our study want to know what's safe. Is what I'm growing at my site safe? And we hopefully all know safety is a judgment that's not purely based in risk. There's a subjective component to it. And for some things, I can tell you what the risk would be associated with consumption, but you yourself have to decide if you're comfortable with that level of risk. So what we at least wanted to understand is, what bar should we have for making judgments for people or advising them? And it was tricky. So we had to consider the consumption patterns of each fruit and vegetable, the seasonality of consumption. So if I'm growing food in Baltimore City, I can't support my tomato consumption throughout the year purely based on my garden. I think the best case scenario when we informally asked around is, how many months of consumption of any given vegetable do you support with your urban farmer garden? And it was extremely rare, any more than a month. And it was often common that, I got a nice crop of tomatoes that I shared with my friends, and it was, an infrequent consumption, which is helpful when making judgments. We can tolerate a little bit higher of an exposure if we're worried about chronic outcomes if the patterns of consumption are infrequent or limited to narrow parts of seasons. We also had to recognize the toxicological metrics for each of these metals. So again, going back to IRIS, reference doses, cancer slope factors that allow us to link an exposure to an outcome. We needed to know, and we didn't have great data on this, the bioavailability of metals in specific items. So just because there's lead in your carrot doesn't mean that it's all available for absorption. And in many cases, the bioavailability data are lacking. And so what we did is we were over cautious. We assumed full bioavailability for everything, and we thought we'd work backwards from there. And then lastly, for certain metals like arsenics, I'm sure you're all very well aware, arsenic species is predictive of toxicology. We did not, in this instance, speciate arsenic, and had we found things different, we may have gone back and selected a subset of our samples to retest and speciate. So what we decided to do is on a chemical by chemical basis, we developed our own bar for each of the metals for each of the produce items. And so we intended to overestimate risk and overestimate exposure, recognizing that would be a good starting point for the discussion. And we hoped it had a calming effect on the people who we talked about exposures with, saying, yes, this is where your carrot came out, but if you think through all these factors, maybe it isn't so bad. One thing that I haven't talked about and I meant to before is we didn't go into this thinking, I want to scare people away from growing food in the city, and I want to scare people away from eating vegetables. If we were talking about candy, maybe I wouldn't be so worried and hung up on the idea that I need to not scare people. But there are many public health benefits to consuming fruits and vegetables, and there are things that we did not measure that are of great benefit that result from eating those foods. And so we have a habit sometimes in environmental health of looking very narrowly through our lens at everything. And I had to, especially with the help of some of our community partners and some folks from the American Academy of Pediatrics that we spoke to kind of put things in context. Yes, we have metals in foods and maybe at trace amounts, but can we throw out the baby with the bathwater if we're too focused on the lead concentration of carrots? And so I just want to plant that seed as we move forward, because I'll return to that concept. But what we decided to do is to try and standardize things. We figured out the amount of a given food that would be in 1 cup or 1 serving consumption, and we presented the results as the metal exposure for each metal for each food associated with consumption of 1 serving as a standard approach so you can compare across vegetables. And it allowed us to present things in a context that people understand. People know what a serving of vegetables is generally. So for arsenic, what we did, again, no arsenic standards for the majority of foods. There's guidance for infant rice and juice, but beyond that, not a whole lot to work with. So we said, let's take the drinking water standard, assume people drink 2 liters of water in a day, and say that amount of arsenic is our line, except for we divided that by 10. So the amount you can get through 2 liters of drinking water in a day at the maximum contaminant limit divided by 10, fairly protective level. Maybe that's debatable in this crowd especially, but we had to have something to compare our results to. With barium, we worked backwards from the EPA reference dose to come up with a dose that would be acceptable. With cadmium, we did ATSDR's minimal risk level for chronic exposure. It was lower than EPA's risk level. In lead, this was the trickiest one because of how often we found lead. FDA has a provisional maximum tolerable daily intake for adults and children. For adults, it's 12.5 micrograms per day. For children, it's 3. They're extremely low. They've never been finalized. And we have lead in our diet. We have a number of these metals in our diet. But I suspect, and this is my opinion, not based on anything, I imagine the reason they're provisional and they've never been finalized is because we routinely exceed them in our diet. And I think the idea that we put an enforceable or even an official standard in place is going to create a panic. So they're provisional, they're aspirational. It would be great to be there, but I don't know that we ever are in our regular diet. And then nickel, the IOM had a dietary reference intake upper limit and use that. So for each food, we took 1 cup and what your contribution of each of those metals would be from 1 cup and compared them to these limits. And it is incredibly uncomfortable to feel the burden of having to come up with some number to compare things to when there aren't official standards, there aren't clinical guidelines for metals in food. But that's kind of the nature of environmental health research sometimes, is we have to be creative and we have to be pioneers. And so that's how I would think of it, as a pioneer and not a fool. Not sure I am a pioneer. Okay, and so reporting back to participants, this was a huge concern. And a lot of what I present today is sort of tailored towards the participant report. one of the things in doing this research is that the participants would know the results before anyone else, on an individual basis and on a citywide basis before we publish. So we're furiously doing our analyses and getting ready to publish now, but it was really key to us that everybody knew what we found before anyone else. And so what I wanted to just pass around for those who are interested, we talked to 40 different stakeholders to develop a document for report back that recognized the diversity of our population. So our study was exempted from IRB because we primarily were looking at environmental and food samples, and we were not taking measurements from people and not collecting personal information. But we recognized in the process of conducting the study that we were affecting people, and we wanted to be sensitive to that. And the people in our study, I call them our participants, even though our sites were the participants technically, some had just finished middle school. And on the other end of the spectrum, we had a garden leader that was a professor of medicine at Hopkins. And we had everything in between. And if you were to survey the population and try and get a sense of what their information needs are with regard to this, they're all over the map. And if you talk to each of our partner organizations or the city's environmental health department, they all had a very different idea of what this document should look like. It was stressful to try and figure it out. So what we decided to do is, recognizing that there are differential information needs across our population, we needed a staged or phased report where we have a short executive summary that's just the bottom line, exactly what you need, what this means for you, and what you should do differently, if anything at all. And then a more detailed version that has maps, and it has metal by metal strip plots that show you how close you were to the standard. And then at the end, we have the appendix with the actual numbers of what we measured. And we hoped, we're going to put this out, and you'll make use of it. And I'll show you in a moment, we had a rollout strategy that we were thoughtful about to make sure we started with the sites that had the most troubling findings with regard to soil contamination. And we talked to them before we gave them this. And we had a phone call, and we made sure, like, this is what we found. Do you have questions? Can we walk you through them? And then after we moved past the sites that were the worst case scenario, we would send these out and we would schedule a call. And we'd make sure to spend time with people. And I can't begin to tell you what an investment in personal resources this was, and emotional resources, because it can be incredibly challenging to communicate findings about a site that someone had been spending time on that may have some contamination issues. And I won't say that people always had the most logical response to this information. Many emotionally driven responses that had a lot to learn about being compassionate and trying to be patient and understand people's concerns. I feel like at the end of the day, we've gotten feedback that we were appropriately patient and helpful, and people were happy with their participation in our study, but I can't underscore enough what an effort it was. So anyway, anyone that's interested, I'm going to pass this around. If anyone wants a copy of this, let me know and I'll send it to you. But anyway, publications are coming, but we wanted to start by sharing individual level information. I mentioned the confidentiality before, and that we did the produce report back separately. And so I mentioned before that we did individual level results first and then community results. Our participants and some of the partners recommended that we wait to do any sort of community report backs until we had all of the produce data. And so we started by doing these soil and water reports because those were the data that were ready from USDA first. And then we had to wait until we got the remaining produce data. And we're now starting to schedule some of these community report backs with all of the data. So this was just our categorization scheme where we started with the category 5s and did those phone calls. We talked to people first, we gave them guidance on what to do. And then we gradually went back to people, and we had many sites that really there was nothing to be concerned with, and it was a total clean bill of health. It felt great to talk to these people. But for the most part, we actually found that with some simple, low or no cost interventions, everybody could continue to participate in urban agriculture without worry about unreasonable exposures, with rare exception people in this scenario. We only had a very small number of sites, and I'll show you the results in a minute, where levels were screaming high. So here are the results. I didn't have a lot of time to include some of the survey results here, but we collected lots and lots of data about human activities, even at a very crude level, that's going to help us with our exposure assessment that we're going to build soon. But people were growing in all sorts of different production modalities. The most interesting one I ever saw, where there was a garden that had these hollowed out straw bales that they would put soil into and grow directly out of the straw bales. I thought that was interesting. But it was very common to see raised beds, and most of them were growing in raised beds that were made out of woods that were not pressure treated, which was great. But there is this misperception in the urban ag community that raised beds are always better, and people would build them out of railroad ties, and they make raised beds out of tires. And I applaud their ingenuity and their creativity, but when it comes to using things that introduce new contaminants into your soil and produce exposure, it's not a good thing. There were not many sites that grew exclusively in ground in unaltered soil, and I'm going to show you some data differences with lead in a moment for that. But our farms and gardens were of wildly diverse size. We had some that were a lot smaller than this little rectangle in the center of the room, and we had others that were the size of 2 football fields. And we had to kind of tailor our sampling, especially the soil sampling, to match up with the larger sites. Larger sites, we did more composite samples. 95 sites imported soil, and so only 9 were growing exclusively in ground. And 38 grew exclusively in imported soil, which was interesting, and it allowed us to sort of make judgments about the quality of the imported soil and how it may reduce exposure. In terms of our irrigation water findings, 86 out of 104 sites were they had some source there, either a rain barrel or a municipal source. I was expecting all sites to have some irrigation water source. Some didn't. Some relied entirely on rain. This next bullet is a little misleading. It implies every site had a source. That's not true. But what was great is that for many of the metals, all of the samples came below the drinking water standards, which is terrific. A small number of sites had a sample that exceeded our drinking water standard for lead. Here are some visual displays of the data. On the left, you have municipal sources, and on the right, you have rain barrels. So again, most sites look great. The red line is the drinking water standard. The axes are different magnitudes, so don't be thrown. They're really the same, 15 parts per billion. With our sites that had municipal sources, we went back and resampled the 2 that were above the drinking water standard, and it turned out that we had not let the spigot run long enough, and we sampled them early in the season. And so after letting the spigot run for 10 minutes instead of 5, the levels decreased. So that was reassuring for those people. The city of Baltimore was very concerned with our testing of municipal water. And there's a stigma in Baltimore around levels of lead in municipal water, and they were worried we would miscast Baltimore's drinking water as unsafe. And based on what we found, I think that Baltimore City municipal water looks pretty good. But the rain barrels were more interesting. These exceedances that we saw were exclusively at sites that had some nearby demolition or remodeling that likely resulted in lead dust settling out into the rain barrels.
Quick question, were these filtered samples or unfiltered?
They were unfiltered.
So there could be some particulate lead there.
Yes.
In the rain barrel.
Yes, and I think that was what we saw. Yeah. Oh, I hadn't, yeah, we didn't do any bioaccessibility assessment, limitation of our approach, and yeah, it's a great point. So it's great if it's or inaccessible, but as we talked about before today, we're measuring lead in irrigation water in the part per billion range, and I think a lot of people were concerned, like, oh my gosh, these exceeded the level, but we're talking about irrigating soils that have easily 100 parts per million lead, so thousands of times higher or hundreds of times higher. So I'm not particularly concerned by this, but I would say that for, never drink out of a rain barrel, but even for the municipal sources, I think we're generally okay for irrigation and even drinking. So here's a very quick summary of our soils data for the sake of time. Things look great for arsenic. Barium was never a concern. All these grays here are non-detects. Nickel is fine. Where we were not terribly surprised was lead. We did expect some lead exceedances, but we were kind of pleasantly surprised in that these are growing area soils. These are not the non-growing area soils. But for the most part, sites were below that 400 part per million New York State soil cleanup objective. So that was terrific news for the confidence of the urban ag community in Baltimore. Chromium was a different issue. So about half of our samples exceeded the recommendation for chromium. And chromium is tricky, and Becky's here somewhere. Talked about chrome speciation and its toxicity across the different species. So our method was tailored to look at total chromium, and that was a challenge because the form of chromium, when you're talking about oil or inhalation exposure, predicts toxicity. And so we found so many exceedances of chromium that we needed to do more. We reported back and we said, please stay tuned for the results of our chromium assessment. So I wanted to just sort of share some background on chromium in Baltimore and in Maryland. So Maryland is in a part of the country that has serpentine soils, and serpentine soils are actually why you see a lot of chrome industry in Baltimore City. There's naturally occurring chromium And it typically forms as chrome-3, which is the benign form of chromium. So Baltimore is this little kind of squarish. Oh, I'm going to use the mouse. Here's Baltimore. And Baltimore is right in the range of serpentine soils. But at the same time, because there is so much naturally occurring chromium, there was a chrome plating industry that was very prominent in Baltimore City, and there was not great accounting for the waste from that chrome plating production. And that waste can be rich in hexavalent chromium. And so we were kind of dealing with, yes, there's lots of naturally occurring chromium, but there could be this potential slag that's resided in soils, and maybe that slag, if it's truly slag and not the naturally occurring, has converted over time through geochemical processes into chrome-3. We just didn't know. And it's difficult to give people a clean bill of health, but we don't want to scare people, and so lots of hand-wringing. And so thankfully, EPA to the rescue. I reached out to a colleague of mine at EPA named Kirk Shekel, who was willing to take some of our samples to Argonne to run them through a synchrotron that would allow him to speciate the chromium in our samples. And I am not going to pretend like I'm great at interpreting synchrotron results, but what I've been told to do is you take, you can look here at the left, you have elemental chromium, chrome-3, and hexavalent chromium. And what we want to do, and these are 10 of our samples, compare the shape of the curve to the shapes of the curves for the standard. And what you can see is that the shape of the chrome-3 oxide curve is very similar to the shape of all the curves in our samples. And his interpretation, not mine, is that our samples look great and they're almost entirely chrome-3. Very, very, very small fraction of them is chrome-6. So it was a sigh of relief for us. Sort of some regret in not having planned for this all along, recognizing the potential for chromium, but we just didn't expect to see that many exceedances. So we were able to go back to the community and say, everything's fine, don't need to worry about the chromium in your sites. So that was terrific. So anyway, I wanted to talk a little bit about the growing soils versus undisturbed soils. So we had information about what sites did to amend their soils for growing. I mentioned before there were 38 sites that exclusively imported they grew exclusively in imported soil, and then we had some that did not import any soil whatsoever. And you can see that there were differences in concentrations across these various categories that are suggestive of differences, that people may be improving the growing area soils by bringing in soils from other sources. There are residual questions about regulatory procedures governing the safety of imported soils, but our data would suggest that the imported soils are safe enough or better. But generally, you can see overall that the mean, recognizing that we use a level of 400 as our soil cleanup objective for lead, all the sites on average were a lot lower than that. So that was good. So here's a sneak peek of the produce results. We've just finished with all of our report backs to the community for produce, and this was the most challenging part of the study. I mentioned where our comparison values came from. I'm not going to go over those again. Some early revelations and signals from our analysis of the produce data is the big question the community had is the food we're growing in the city worse for than food from the grocery store? And as you'll see with some of the data in a moment, there were not differences across production categories. And this was a huge sigh of relief for people who grow in the city. However, for people who eat vegetables, it was not a sigh of relief because while barium, cadmium, chromium, and nickel concentrations were not of concern based on our risk calculations, there was lead in every sample. It was ubiquitous. And to a lesser extent, there was some arsenic. And there were patterns by different produce items. And so that became our real communication challenge, recognizing the value of fruits and vegetable consumption and the risks of metals exposure. There were differences by produce type. So typically for lead in particular, our root vegetables had much more contact with soil and had much higher concentrations of lead in particular. One thing I wanted to mention too, I think there have been some terrific examples in the methylmercury literature looking at fish consumption and the potential benefits from exposure to omega-3 fatty acids and the same risks affecting development coming from methylmercury. And I think there would be great value in someone doing the same thing for lead in fruits and vegetables. But one of the challenges is, I think with methylmercury and omega-3 fatty acids, we're talking about the same organ system that's affected. But with fruits and vegetables and lead, we may be dealing with different organ systems that are affected. So doing a risk-benefit comparison becomes a little bit more complicated. And so anyone that's interested in going in that direction, I would love to talk more. We did not do that. So here's a couple of just selected results from our study. So on the categories, and we did these strip plots because we, through a lot of exploration with participants, found that these are the easiest things for people to understand. These are the limits we did for arsenic or whatever we're looking at. And then we plotted each that limit, just to give people a sense of where they were. So, in this particular example, this participants' cucumbers right here with the blue dot, and they were a little bit above our adult limit, but recognizing, as I explained to you before, we started with a number and then scaled down by a factor of 10. I'm not really concerned to see that. But what we see visually, and I think the visual comparisons were super important for our participants because they don't understand what p-values are, they don't know what standard deviations are. This is a way to show you, like, this is not very different from what you're getting from the grocery store or what you're getting from farmers markets. And it makes our public meetings a lot simpler. Speaking in scientific language, I have learned through experience, does not go well when you have a room full of people that don't have PhDs or master's degrees. Here's another example of potatoes, and this is one where you can sort of see our stress and frustration over the provisional lead numbers. So here, this black horizontal line is our child limit. I'll show it for those online. And you can see that only one sample, a cup of, would put us below the child limit for lead. This is really stressful to communicate to people. People are most worried about lead exposure in children. We're not quite as worried in adults, although we should be worried to some extent. But many of the samples exceed the adult daily limit, and this is one serving. And with some of the fruits and vegetables, we're dealing with people who are growing food in the city and who are passionate about it. And I had one participant tell me, I'm probably the 99.9th percentile for kale. I eat so much kale. And so your assumptions about my exposure of one serving per day, you're nuts, you're totally wrong. And so how do you deal with that? How do you talk to that person? Maybe we recommend, maybe you don't want to be the tail of the distribution. Maybe you need to diversify your diet a little bit, but that's an uncomfortable conversation to have. But still, we had to have these conversations and had to recognize, and thankfully that person was very reasonable and understood, maybe you don't want to be the tail of the distribution. This is lead in carrots. This is one of the worst case scenarios from what we found, and this is not inconsistent with what's in the literature. But again, the demonstration, there are not great differences across production classes. We tended to test more urban samples because we collected them than we did. We only did 10 of each of the other categories. But I still think the message visually comes across that there are not grave differences across these different production types. And so that was good, although the child limit, again, troubling.
Could you explain why there are two scales that are very different on the left and the right side?
This is the percent of the child limit, and that's the percent of the adult. No, it's fine. I should have explained that. So let me circle for our online audience. On the right y-axis, we're talking about a child limit, so the black line, the black text, and on the left, we have the adult limit, the red line, and the red text. And so again, I should also specify the left category is urban grown. Then we have rural or the peri-urban or farmers market samples, then the conventional grocery store samples, and the organic samples. Okay. So in communicating to our population, here are some of the messages that we sent. The amount of metal in a site's produce could vary across the site and over time, depending on amendment and any changes you make to the site and what you grow where. So things can certainly change. But we also see variability in what we get from grocery stores. And if you were to sample from grocery stores over time, you could see some peaks and valleys, and isn't necessarily concerned for alarm or any conclusions about differences. This was a big one. No diet is free of metals. Again, if this is not something you read about or think about all the time, this came as a shock for a lot of people. And so we wanted to convey to people who were urban farmers and gardeners, we're not worried about the produce. What we're much more interested in is your contact with soils, because if we were to do the math and do the exposure modeling, which we're going to be doing next, the soils really account for much more exposure. And other potential pathways of exposure to lead can be more prominent in what you're doing. So this is a tough thing to come to terms with, but we had to work people through it. This is the notion of the fact that we don't get all of our produce, we don't get all of our potatoes from our urban garden. And so if you exceed that daily limit, sometimes this daily limit is intended to correspond to chronic exposures and health effects. So recognizing that you may eat 10 potatoes out of your garden throughout the entire year, you don't need to be that panicked about the levels that we found in your farm or garden. If you were exceeding that limit repeatedly over time, then there's a greater potential for health outcomes. But I think for the seasonal nature of urban agricultural production, urban farms and gardens should not be at the top of people's lists in terms of concern. And then in a typical day, people eat lots of different foods that we didn't measure. And many of those other foods, and again, without scaring people even more, there are other foods that have metals, there are other foods that have lead, there are other foods that have arsenic. You know, we didn't really go down the road of talking about rice with people. Didn't want to introduce new concerns among people who are already panicked about lead in their vegetables. But you know, we're giving you a snapshot of one group of foods, and we're not taking into account the many other potential benefits of eating those foods. So we were interested in really contextualizing and not causing people any alarm. And our overall recommendations, based on what we found in fruits and vegetables as compared to what we found in site soils, is we don't advise that people change their vegetable consumption patterns based on what we measured, especially given the notion that what we found at urban sites is no different from what we found in grocery stores, and we've been eating at those rates all along. That doesn't mean we shouldn't pursue potential interventions in the future to lower people's exposures through produce from the grocery stores, and it doesn't mean that maybe FDA could develop guidance based on typical patterns of food consumption and accumulation, especially in root vegetables. That would be an opportunity for exposure reduction. But for now, for our urban agriculture population, we don't see advising them to not eat urban produce as a priority. So I mentioned these before. Eating a diet rich in fruits and vegetables is of great value. For people who are worried about metals, we think the soil interventions that we present in the document I passed around the room is going to be much more fruitful in avoiding exposure to the metals that we've described. And most importantly, with rare exception, we didn't need to tell people to walk away from their sites. We thought, you know, most of the sites look great on their own, but if you are concerned, there are inexpensive or free things that you can do very easily that can minimize your exposure. So we think Baltimore City is a great place to grow food and to experience the benefits of urban agriculture. So big team, Army of Research Assistants, some funding from the USDA and from a number of different centers around Hopkins. So many amazing collaborators. This was a really rewarding project to be involved in, and I feel very fortunate that the city of Baltimore and its urban ag community embraced us and trusted us with their data and their samples, and they haven't told us to go jump in a lake yet, so we're hoping to continue to stay engaged with them and continue to look at other aspects, benefits and risks of urban agriculture. But thanks so much for your attention, and I'm happy to answer any questions you have. Yeah.
So this is all farms that already exist and are with all the information that you made now, there's going to be like some sort of document for new farms or credits.
We're working with the city of Baltimore based on our results to revise their soil guidance, and it's going to include recommendations for new farms and gardens that are going to start up. And we actually, through one of our funding sources, got some money to make some instructional videos on how to minimize contact. So it'll have guidance for those people as well. It'll be my pretty face telling people what to do. Yeah.
Well, the amount of lead in the vegetables was troubling. You said you went on to the assumption of 100% bioavailability,
Yes.
right, which is highly unlikely
Exactly.
in most of the cases. So those levels are most likely much lower than what you see.
Yeah, and even though I didn't put those on my slides today, we did convey that that was a concern. It's tricky when people don't know what bioavailability is to say that this factor that you don't fully understand probably means it's not as bad as we're showing it to be. But that's a great point. Yeah.
Did you show us any data for soil from non-food growing areas?
No, we didn't collect any food. Oh, are you saying for the non-growing area samples? I showed you a comparison. Very quickly jump to
I'm
it.
just wondering how much higher these were, if at all.
This figure that I ignored, because I jumped to this. This is a comparison by site. If you take the concentration of lead in the growing area soils and subtract the concentration in the native soils. And you can see that for the majority of sites, this is a cumulative density function. There's some pretty substantial differences. For a small number of sites, they're actually, the growing area soils were worse than the non-growing area soils. Function of parts per million. Yeah.
But the means were still pretty low. 1.5 ppm.
Yeah.
Surprisingly low.
Yeah, it was great news based on what we expected. Yeah.